So when Beth wrote her trend, Women Get Their Own Lane in Longevity, she referenced these next two powerhouses who are helping redefine the future of health, wellness, and longevity, especially for women. Alexia Brue is a pioneering voice in the global wellness movement and the co-founder of Well and Good, one of the most influential wellness media platforms. Long before wellness became mainstream, Alexia helped shape how millions of people thought about health, prevention, and everyday well-being, bringing credibility and accessibility to the conversation. Alexia recently launched The Practice, Habits for Healthspan, which is a bricks and mortar facility in Greenwich, Connecticut, which Alexia describes as a retirement plan for your body. Alexia serves on the advisory board of the Global Wellness Institute, and she's a longtime friend of all of ours. Joining Alexia is Robin Berzin, MD, founder and CEO of Parsley Health, a trailblazer in functional and integrative medicine who has transformed how care is delivered. Robin has been a leading advocate for proactive, personalized, and preventative healthcare, addressing the gaps in traditional systems that have long underserved women, especially those across midlife, hormonal health, and long-term vitality. Alexia and Robin first came together on our Wellness Roundtable podcast, and it's a rare treat to have them together again today. Get ready for a conversation where media and medicine, culture and clinical insight, consumer behavior, and science come together. Please join me in welcoming Alexia Brue and Robin Berzin.
Thank you, Nancy. Where do you want to
Sit here? Okay, great.
So Dr. Berzin, hi, good morning. You and I did a warm-up to this conversation when you joined the Global Wellness Institute Wellness Roundtable podcast, and we talked about broad strokes longevity. And needless to say, this is much better in person. Same theme, better shoes. You just did a fabulous intro, Robin, so I don't need to reintroduce you. But what I love about this trend that the brilliant Beth McGroarty got angry about, and it's incredible. It's 11,000 words, and there's so much amazing stuff in there. Is it still 11,000 words? I don't, it's incredible. Anyway, what I love about this trend is it's not just women entering the longevity space, it's women redefining the longevity space. And this report makes a very strong case that women will pull longevity away from its superhuman Brian Johnson-y optimization and towards something more human and health span focused. And that women's longevity medicine will emerge as a distinct clinical and wellness category. So Dr. Berzin, I'd love to get your perspective on the reframing of this.
You know, in my experience as a functional medicine and longevity physician in practice for over 10 years and running Parsley Health, where we've seen over 50,000 patients, 80% of them women in this time, and we never stopped prescribing HRT. What I've seen is that women are less interested in a competition to see who can get to 120 first, and they're more interested in living their healthiest, happiest, strongest, fullest life now. And as a 44-year-old mom of 3, that's where I am, and that's where we're guiding all of our patients and our community of women who want to feel good and look good and be able to live their story.
And so where are you seeing this shift show up first? In new language, new behaviors, new demand? And I guess more concretely, what are your female patients asking for today that they weren't, say, 5 years ago?
I think we're moving from reactive and symptom focused to proactive medicine that is personalized and N of 1. We are doing proactive testing, not waiting till the wheels fall off the wagon and then saying, oh, we should do something about it. That's across hormones, it's across metabolic health and blood sugar, it's across bone density, all big topics that I know we'll get into. And it's really around, and heart health, right? Heart disease is the #1 killer of women, but we've sort of overly categorized it historically as a man's disease. And so this, when I trained in medicine at Columbia for med school and Mount Sinai in internal medicine. And when I was in my training, I was constantly told, don't overtest. Don't overtest because it costs money. And all I could see in front of me was people for whom, had we tested a little bit more, maybe a decade or a few years before, wouldn't have been in that hospital costing hundreds of thousands to millions of dollars in totally preventable, reversible, treatable diseases. Today, ACOG, not to pick on them, sorry, but American College of Obstetricians and Gynecologists still recommends a DEXA scan at 65. You lose 20% of your bone density as a woman in menopause in your 40s and 50s. You start losing bone density when you're in your 30s. And in a world where we are sedentary and inflamed, we are depleting our bone density far earlier than 65, waiting until you have a fracture or you're 65 to get a DEXA scan is insane. And so one of the things that we're recommending regularly, we're actually bringing full body DEXA into Parsley's clinic in Flatiron. But I'm telling women to throw away the scale. I do not care what your weight is. It is not a measure of your worth or your health. I want your body composition, lean muscle, bone density, and fat mass. And that's what we're going to optimize. And I'm hoping that everybody becomes a card-carrying knower of their body composition 30 plus.
All right, so that's good homework for today. So we're also seeing, as Beth was talking about, the ovary really emerging as command central. And sort of let's talk about some of the biology that's been under-discussed or over-siloed. A lot of people think with ovaries, an ovary span, which I love that new term, that it is more fertility or menopause focused. But what is changing culturally and clinically that's expanding this conversation so that we're starting to see the ovary of the driver of how women age?
Well, there's just been a lot of really cool new science in 24 and 25 looking at the ovary as a driver of our overall aging process and aging velocity. As our ovaries age and blood flow diminishes, just like blood flow diminishes to our brain as we age and then we lose cognitive function, just as blood flow for folks with heart disease diminishes to the heart and the heart loses function, as we age, as ovaries lose some of that vascularity and blood flow, it actually determines the aging velocity of the entire body. Metabolically, immunologically, meaning our immune system and how we regulate inflammation, as well as fertility. And so what I think this is about really is, we always sort of categorized women's health as fertility and menopause, essentially as narrowly around your reproductive capability. And now we're understanding the interplay between your reproductive hormones and your reproductive health and the rest of your health.
And so if you had to pick 3 markers that you wish every woman in their 30s and 40s tracked to build her longevity runway, what are they in terms of hormones or other things? I mean, and you mentioned obviously the DEXA and the muscle mass.
Yeah, I mean, full body composition and DEXA would be number 1, and that's looking at a composite, again, of fat mass, including visceral fat. Visceral fat is that fat not on the outside of our body, but inside that wraps around our organs. That is heavily inflammatory fat, and the more of it we develop and have, men or women, the more inflammation we have, the more heart disease we have, the more likely we have stroke and dementia. And actually, we now know that that fat is signaling inflammation that causes further bone loss and drives osteoporosis. So another plug for body composition and full body DEXA. The next one is fasting insulin. We've historically looked at hemoglobin A1C, which is looking back at 3 months and sort of understanding diabetes risk. That's a too late metric in my view. We need to be looking at fasting insulin. If you're fasting insulin, I want to see it below 5. And on a lot of tests, if you're super metabolically healthy, it'll show up as less than 2 or undetectable. Anywhere over 10 and we have a problem. And that is an early signal that we are metabolically unhealthy. And we know that our metabolic health is also our aging velocity. We're now connecting metabolic health to dementia in the ways that our metabolism changes the immune cells in our brain called the microglia from friend to foe, leading to diseases like Alzheimer's. So we are an ecosystem. So full body DEXA, fasting insulin, and then estrogen. And, I don't think this one should be controversial, but it is. A lot of the services out there, a lot of the online services promoting hormone replacement, I'm all about them from the standpoint of access because we need more hormone literate providers and access. However, a lot of them are slinging hormones without any testing, and it's irresponsible. And we've had this message out there, you don't need to test your hormones, just look at symptoms. Well, that doesn't make any sense. When women's testosterone levels vary over time, some women lose their testosterone in menopause, some actually maintain it. I have patients in their 60s who've got rockin' and rollin' testosterone. They don't need tea. I have women in their 40s, their testosterone is tanked. They really benefit from it. And while hormones are erratic in perimenopause, we know that that's not a reason not to test. And so we know that estrogen is one of our top longevity drugs. I've written about this extensively. And so I believe testing hormones, but testing estrogen and understanding your estrogen curve and levels along with your other sex hormones over time is really powerful.
And so one of the things this trend posits is that the conversation around HRT will move away from HRT for menopause and more towards HRT for longevity. But you're saying yes, but with testing.
Yes, and with testing. And I wrote about this last year, and I'm going to continue to speak about it. I believe that, my mom is 81. And in the early 2000s, she was on HRT, the old version, the old problematic, wildly problematic version of HRT. And when the Women's Health Initiative study came out and said, there's this increased risk of heart disease and cancer and so forth, her OB, to his credit at Johns Hopkins, I grew up in Baltimore, said, I don't like this data, and we're not seeing any of this in practice. And he kept her on it. And my mom was on HRT for 20 years when everybody else was off, and it's massively impacted her health, and in a positive way. And I think that we are going to move from HRT as symptom management to HRT as proactive longevity drug that not everyone, but nearly everyone should seriously consider being on starting in perimenopause.
Got it. And so that's a conversation people should have it in their 40s and yeah.
Yes.
Okay, so we'll move from ovary command central to muscle, the infrastructure. It's the thing that really determines whether the system holds up over the decades. And this trend talks a lot about how muscle span might be the most bankable intervention in women's longevity. So Dr. Berzin, what do you want women to understand about strength training as a health span lever and not just an aesthetic one?
Outside of estrogen, muscle is really our other top longevity drug. It's our longevity tool. And older women who have less lean muscle mass have a 63% higher mortality rate. 63. And so building lean muscle, right? I grew up in the 80s and 90s. I was told, everyone wants to be small and don't bulk up and all of these sort of societal trends that are wrong. Building lean muscle is critical for our brain health, our bone health. You can take all the estrogen in the world. If you do not lift, you will not build bone. A lot of people think that they're like, I'm on the estrogen, I don't need to do anything. No, you have to actually lift things because your bone is stimulated by impact. So power plates and lifting heavy and jumping and so forth. And then building lean muscle mass is what ultimately, allows us to have what's called metabolic flexibility, which I've written about as well. We talk about metabolism a lot, but metabolic flexibility is what really matters. It's your ability to move back and forth from burning fat for fuel and carbs for fuel. We need both. And when you don't have good lean muscle mass, you're not able to move back and forth. And that's what leads to, in the short run, feeling exhausted, anxiety, blood sugar crashes, weight gain, and then long-term, some of the chronic diseases that we've talked about.
Yeah. And I just know from one of the reasons I started the practice was to help women build muscle and have progressive overload programs to do that. And we do body composition testing, and women are profoundly under muscled. That's been my one big takeaway is they don't realize that they're losing 5 to 10% of their muscle mass per decade if they don't intervene. And you and I've also talked on the podcast about how there's a lot of focus on supplementation and different things like that, which are, as you said, not even the icing on the cake, they're the letters on the icing on the cake. And we're sort of missing the main thing, which is lifting heavy. Maybe if you want to share a little bit about your own personal journey.
So I was diagnosed with osteopenia last year in my hips at 43, which was very surprising to me. And it has really sort of put me on a trajectory of a major focus on bone health and understanding body composition, tracking body composition. And so I'm working to reverse that osteopenia right now. And I'm doing it through weight training. I'm doing it through adequate protein intake. I'm doing it through specific supplementation that is targeted. Supplements are helpful tools when they're safe, tested, professional grade. They are what they say they are. You're using them for a reason. I prescribe supplements and I prescribe drugs, and they're both massively helpful. But I'm taking a prebiotic probiotic blend that's been shown to reduce bone loss. I'm also taking a supplement called Algae Cal Plus, which is about helping my body build bone. And so I'm going to be tracking this over the next couple of years. But the other thing that I want women to really understand is you can reverse osteopenia and osteoporosis, just like you can reverse heart disease. And I believe we will be able to reverse dementia as well.
Wow. Okay. Next year's trend, Beth. Okay, so the interventions are getting clearer. Now the bigger question becomes who delivers them well? Because women don't live in one silo. We move between clinicians and coaches and tech and wellness brands. And this report predicts that the gym will become the women's longevity clinic, which I love. But Dr. Berzin, I'm wondering, where do you draw the line between what belongs in a gym and training environment and what belongs in medical care? And what does a great handoff between those two look like?
I think in the fitness world, we're seeing so much more sophistication around data and bringing that data to light for people in a way that's actionable. I'm on Whoop's medical advisory board, the wearable company, and just the level of data that you can have through some of these wearables like Whoop today, where you can have data that used to be only accessible to you in a hospital, is really incredible. And it gives you so much more insight on yourself. And then you need an actual medical professional because AI cannot be your guide. It can give you information. It can even give you some of the right information, but it can't be your guide to making these decisions and trade-offs and prioritization and help you navigate medical decision making. And so, Parsley is the largest functional medicine and longevity clinic in the US. We're 50 state national telehealth as well as in person in New York and LA. And I think you're speaking to a gap because I think where the fitness community is trying to close a gap by getting some of these things like DEXA and metrics into folks' hands is amazing. And we have a gap in longevity literate clinical medicine that there's not enough of. And I'm proud to say Parsley is the only one in the country that's in network, and we have a lot more news coming there. But there's, I think we'll see more and more of that. And I just want to remind us that unfortunately, our women got schooled to believe that the gynecologist was their home base for their health. And I love my OB/GYN colleagues, but they are not primary care doctors. They are not trained in longevity medicine, nutrition, any of the topics we're talking about. They're often not really trained in HRT properly. And so what I think you're going to see is the rise of what, we're building and have been building now for a while, which is the clinical layer of longevity that can help you when, yes, this is about performance and fitness, but also you have autoimmune disease and you have early signs of heart disease and you have early signs of dementia and you need medications and we need to decide on which GLP-1 because now there's 85 of them, right? Like that still requires a doctor in partnership with everything I think we're talking about.
Great. And I want to sort of close this conversation where we started with the idea that women aren't just joining the longevity conversation, they're humanizing it. And so last question, what's the most important mindset shift you wish every woman would make at 40 that would change her trajectory?
To mindset shift from I should to I get to. For me with young children, I'm constantly thinking about how I want to live a big long life with them. And I get to lift and I get to do yoga and I get to do zone 2 and I get to take my supplements and I get to eat healthy and I get to remember to eat protein and I get to find ways to fit all of this into my life. One of my mom friends the other day was like, all right, Robin, like seriously, like how are you doing the sauna thing and then all this other stuff? How do you have time? And I'm like, but this is my motivation. Like, this is the life I want to live long term. And it's enabling me to do all the things I get to do right now and to feel good. And I think when we get out of that, I have to, I should, oh no mentality, that reactive mentality, into, wow, I get to do this for myself. So I feel good now and into the future. That mindset shift I've seen in patients and friends and myself just catapults you into a different relationship with your body, because your body's the only vehicle you're going to have for life. And so I just get great pleasure in taking care of it. And I think that's a big shift when we think about female longevity, when for many of us, again, like growing up in whatever era, we were sort of at war with our bodies. And I think we're changing that.
I love that. That's inspiring. Thank you, Dr. Berzin. And I just want to close with Anna Berstrom's challenge, which Beth included in this, which is for all of us in the room in the industry. Let's build clinics that don't just extend years, but ones that deepen connection, purpose, and awe.
Alexia, hang on one second. Alexia, first of all, give our microphones back. Okay. The But the other thing is that you were this was a fantastic conversation. I thank you both so much. And you're so humble, and you spent all the time on Parsley Health. So just take 1 minute and tell us what the heck a retirement plan for your body is about the practice.
Sure. So we just opened a pilot location in Greenwich, and we do a couple of different things. We are a Healthspan assessment center. So we have people coming from all over the tri-state to do, it's basically a 2-hour assessment that measures everything from VO2 max to body composition to grip strength to functional movement. And then we also offer personal training so that someone can really improve their health span. And so we're really focused on helping people build skeletal muscle mass, because it's easy to say just lift heavy, but there's actually a real science to it. And then every 24 sessions with our clients, we're looking again at how the intervention is working. Like, are they building muscle mass? Are all these metrics improving? So we're holding ourselves to say, hey, does this work?
But you're like one of the original online media people.
Yes.
In the wellness space. Now you have a bricks and mortar location.
It's very different. No, it's really fun. I'm enjoying it's like delivering care. Like, I couldn't be a doctor like Dr. Berzin, but this is my way of doing that. And, some people dream of opening a cafe, and I just wanted to open a fitness center. So I'm having an absolute ball with it. And if anyone wants to come visit, we can do your whole assessment in one visit.
All right. There you have it. Beth and Jane, come back up. Thanks so much.